When I talk about the Brain Wealth program that I've put together and the 12 key components that I say have to be looked at in any comprehensive program to prevent dementia and Alzheimer's, there are some people who question me. They ask, is there any scientific basis for what you say? Well, first of all, my background is in science, which is biological, Western medical, natural medical science, and functional medicine science. My background and orientation is empirical, meaning looking at the evidence and using what works. I stand on the shoulders of brilliant and day in and day out clinical practitioners. I stand on the foundation of scientific and medical studies. I rely on my own 30 plus years of clinical experience as well. For more than 45 years, I have engaged in the study of how our bodies, mind, and spirit operate. I have studied many areas of medicine with MDs, PhDs, naturopathic doctors, laboratory directors, doctors of chiropractic, and many, many others. The fields I have studied cover the gamut from neurology to immunology, from endocrinology to toxicology, from the realm of straight physical medicine to the realms of mind medicine and mindfulness. Frankly, I don't quite understand where the skepticism comes from when someone questions the validity of what I offer. I am loath to think that it comes simply from a narrow, pharmaceutically based drugs are the only answer perspective that some people hold as their medical belief system. People are brought up in a cultural context where drugs seem to be the only answer. Now, I do not discount that some medications are beneficial, but I am in a very large group of experts who agree that there is no silver bullet drug that is the answer to Alzheimer's and dementia. Even the Alzheimer's Association states that Alzheimer's and dementia is a multi-dimensional caused problem. Now, I look at the way that drugs are advertised on commercial television. Perhaps you watch TV and you see these commercials as well. In the past, they used to be able to say anything and it was okay. And then the FTC came down on them and said, no, you can't advertise at all. So there was maybe a 25-year period where the pharmaceutical industry could not advertise any drugs on the air. This was because so many people were watching it and going into their doctors and demanding that they get that drug. Well, this was a very effective way of selling, but there were a lot of problems with that. So finally, the FTC and the pharmaceutical industry agreed that they could have the advertisements again on TV. They could excite the television watcher to want to have a particular drug and go in and talk to their doctor about it. But the compromise was that the pharmaceutical ads had to include information about what the side effects of the drug and medication were. So once again, they have to state what the side effects are. And if you watch these commercials, which I do because they're television programs I love to watch, these commercials have happy faces and smiling and children and dogs and balloons and things like that, or parties outside and barbecues. They have these pictures going in the background talking about what these particular medications can help with. And then typically more than 60% of the ad, the second half, is talking about the side effects. And often these side effects are exactly the thing that they are supposed to be helping. So often these side effects can be exactly what the drug is prescribed for, and I find that quite ironic. You know, But even more so, I watch the visual on the screen, while the potentially deadly side effects are spoken and they're listed by a voice in the advertisement. The advertising geniuses who create these, they create an idyllic, beautiful, happy, life-affirming background picture that is in complete disconnect from what is being stated. It is amazing to me the hundreds of thousands of dollars that are paid advertisers to blunt the reality of the side effects of the drugs. Watch this very carefully the next time you watch an ad. In fact, here we are actually going to show you an ad and exactly how this happens. I mean, you'll see these happy people in the background doing things, whereas the actual what is being spoken, the auditory portion versus the visual portion, is about a lot of negative things. So they are trying to mitigate the negative aspects by putting this visual picture up there of these happy people. And often people say that words speak pictures speak 1,000 words. And so I think they're trying to use the pictures to over speak what they're actually saying about the drugs.
For joint damage, Xeljanz can lower your ability to fight infections, including tuberculosis. Serious, sometimes fatal infections, lymphoma, and other cancers have happened. Don't start Xeljanz if you have an infection. Tears in the stomach or intestines, low blood cell counts, and higher liver tests and cholesterol levels have happened. Your doctor should perform blood tests before you start and while taking Xeljanz, and monitor certain liver tests. Tell your doctor if you are in a region where fungal infections are common, and if you have had TB, hepatitis B or C, or are prone to infections. Xeljanz can reduce the symptoms of RA, even without methotrexate, and is also available in a once-daily pill. Ask about Xeljanz XR.
So getting back to the topic at hand. So when someone questions the basis for my brain health program, these 12 key components, I try not to react personally. But in fact, my first response is feeling a little offended that they are questioning my integrity, the integrity of my 45 years of study and my 33 years of clinical experience. Because the basis for what I offer patients is founded on so much solid knowledge that is so factual. It is almost, in my mind, like questioning the existence of gravity. So I hope this helps you better understand where I'm coming from and why I believe so strongly and I'm so certain about the help you can get by going through the brain wealth, improve your life, improve your brain, find a new life, find a new brain program. Thank you. This is Dr. Jay Sordian, wishing you the best of health and the best in life.